Looks like we're good.
Okay. Hello, everybody. Welcome to our town hall series, and this is the second in our series. My name is Daphna Michelson-Janae, and I am the state representative for House District 30. We are here today to talk about mental health, and mental health is the number one reason that I ran for office, and a lot of the work that I do centers around it. And today we have some of my colleagues with me who are also working in the mental health space. And I thought it would be wonderful to have a conversation with them about what's going on now in the time of COVID and how did we get here? So first of all, I'm going to introduce all of our panelists, and I'm going to say thank you to Talia for her incredible work on this, and Josh for the technical support and getting me in here at the last minute, because everybody else got in and I'm the one who had the technical problems. So on our panel today, we have Mo Keller, who's been with Mental Health Colorado since 2010. Prior to that, she served for 8 years in the Colorado House of Representatives and 8 years in the Colorado Senate, for which you should get a purple star. She has done a lot of legislation around mental health, and she was the author of the Children's Mental Health Treatment Act. And prior to her work in the legislature, she was a special ed teacher for deaf and hearing impaired children for 25 years. So thank you so much for being here, Senator Keller. Yeah, we also have Kristen Orlowski. Did I say it correctly, Kristen? Yay! Yeah, you did. Thanks. Kristen Orlowski is a licensed psychologist and a natural leader who values and respects the opinions of her peers. She graduated from the California School of Professional Psychology with a PhD in clinical psychology and clinical forensic emphasis. So that's very, very interesting, in-depth portion. We also have Commissioner Chaz Tedesco, who, among other things, is my constituent. My dogs have decided that now is the time that they're going to play. So we're going to just watch them come in and out of the scene. Chaz served honorably in the United States Navy and honed his craft as a master mechanic for 23 years. He's a member of the United Steelworkers Union and was elected president of United Steelworkers in 2005, a title he proudly held until 2013. Commissioner Tedesco is best known for his work for foster youth and making sure that our foster families get the help and the support that they need in Adams County. And I'm very excited that he has joined us here today. We also have Loveleen Kaur, and Loveleen is the co-founder of the organization Letters to My Generation. And Letters to My Generation is a very significant organization that has reached out to youth and said, hey, we are all struggling. And how about we start sharing some letters to each other to help us make it through? And I am incredibly impressed with the work of this organization. And they have made it their mission to come and testify on a number of the pieces of mental health legislation that I have been honored to work on. So please welcome our esteemed panel. And thanks for joining us here this afternoon on a lovely Sunday afternoon. So I'm going to start by asking a real general question regarding the time we are in during COVID, and simply asking, what changes have you seen as it relates to your own work around mental health since March, since we went into quarantine? So Senator Keller, why don't I start with you?
Fine, thank you. I work for Mental Health Colorado, which is a nonprofit organization, and we have our offices downtown, just 2 blocks south of the state capitol, because we are very strong on advocacy, and we do a lot on public policy at the state capitol. We introduce bills, we testify for bills in terms of better policy for mental health. And we have 15 people in our office. Well, since mid-March, our office is closed and we are all working from home. We have been maintaining some office esprit de corps, if you will, by having Zoom meetings. I think everybody is so zoomed out, but we are doing those to take care of each other, have calls to each other. But we continue to be actively engaged at the federal level on federal legislation and at the state level on state legislation. COVID has changed the scene in terms of public policy dramatically in a couple of ways. One is the economic hit. Our state, like all others, had to cut the budget very significantly, greater than any time in the history of the state, actually, $3 billion. And so as Representative Michelson-Jeannet knows full well, we lost some very good bills that we should have been moving forward with on mental health for children, mental health for adults and seniors, because they cost money. And so we not only lost those opportunities, we also had to dig in with bills we had and policies we had made in several years prior, and we lost funding for those as well. So that's one way. The other way that COVID has affected us at work, as well as other nonprofit organizations, is trying to promote wellness in a new way, such as telehealth, which I'll talk about a little bit later, is a new way of providing services, reaching out to people in social media in a new way, reaching out, trying to change our events from where we would have get-togethers in person. Now they're going to be get-togethers virtually. It's made us think differently about how we are going to get our message out, how we're going to reach folks, how we're going to include people to come in, and maintain that human connection, because that human connection is so important. And we, for the most part, lost it. We've lost that human connection. So how do we bring that back and continue to outreach to people so that we can reduce the sense of isolation, which an awful lot of people are feeling right now?
Thank you, Senator Keller. Commissioner Tedesco, can you talk a little bit about increased need you've been seeing in the county and what the county has been able to do as a result?
Absolutely, Representative. I just want to say, first off, it's an honor to sit on this, with all these, incredible people with backgrounds that, I wish I could compare to. You guys have, really dedicated your lives to this. I'm a servant leader. My job is to kind of gather the resources and distribute the resources. One of the things that we've seen in Adams County is that, with the COVID, it has put us in isolation, like the senator said, and it put us in a different work environment. But it's also put our kids in a different environment, at home. And they don't have the release mechanisms that they used to have in the schools, in the playgrounds, in their friends, and just associating with others. And what's really detrimental in this is that this is, in most cases, such a critical time in these kids' lives to have that social interaction, and then to be isolated. It's going to be detrimental. I grew up in the foster source, in the foster system. I know what that's like. I know what it's like to, have that in the back of your mind for the rest of your life, and what it means to deal with that. Our human service representatives can't go to the homes as regularly as they want to right now. Our services can't be utilized as well. Some of the things that we do when we go to the homes and we try to visit the kids is we try to recognize whether there's any abuse or other things that are going on that could, impact their mental stability or their mental health. And, doing it over the phone or doing it in very limited fashion doesn't allow us to give those services as well as we should be giving them. I'll just say, with the COVID impact on this, I don't think we're going to see the impacts for this, the really true impacts for this, for at least another year, if not for, decades to come.
I agree with you. I agree with you, Commissioner, and we'll keep talking about that. Loveleen, can you talk a little bit about, tell everybody what Letters to My Generation is, please, and talk a little bit about how your peers have been impacted and what you've been seeing based on what's happened since COVID.
Yeah, of course. Well, hi, my name is Loveleen. What Letters to My Generation is all about is, well, when I first started, it was a really small group of people, and I got put onto the logistics team, and I reached out when it was a really hard time in my life, and so I knew right immediately that I wanted to be a part of this. And basically, what Letters to My Generation is about is
Does anybody else having trouble hearing?
Yeah, we can't hear her. I'm sorry. We lost her.
Okay, Loveleen, somehow we lost your audio, but you are not on mute, so I'm not sure what's going on. So let me come back to you and go to Dr. Orlowski. If you could tell us what you're seeing and thinking, etc.
Sure. So basically, since about mid-March, of course, we've had a significant increase in home telehealth services, and it was really nice to have on the added addition of telephonic sessions, because previously that wasn't something that we were able to get reimbursed for. But it's been a really great addition just to help with access to care for people who are financially hurting, or especially elderly, and people who just don't have internet services. So just logistically, there's been a significant increase in the virtual visits and the telehealth services. But in addition, I mean, you have the kind of the normal flow of people coming in and seeking treatment for various mental health needs, but then, it's exacerbated those symptoms. They're more acute. There's the new onset of a lot of symptoms. People who are depressed are now more isolated. They're not able to seek out their social supports. The depression is worsening. There's anxiety is not only related to COVID specifically and health conditions, if they're high risk especially, but all kinds of other anxieties because of increased levels of stress, financial stresses, people losing their jobs, having difficulty adjusting, parents who are trying to now work full time and also take care of their children's academic needs. It's just really exacerbating a lot of symptoms that maybe were there already or with new onsets of symptoms. So we've been seeing a definite increase in that, not to mention we've seen opioid dependence and child abuse, neglect, all that is increasing. Kids are, I think, really starting to struggle with the virtual environment because they thrive on peer interaction. And so that has been something that's been really difficult, particularly students who are new to schools and don't know anybody else yet. The virtual classrooms, the virtual environments aren't giving space for them to socialize and have like their social outlets that they would in person. So that's been hard. A lot of kids having a hard time already with focus and concentration virtually is a little bit harder, and it's harder for teachers as well to be able to provide those prompts and redirections when it's happening virtually. Parents aren't always as engaged as we would like because they're working and they have, a million other things in these days that they're trying to also accomplish and focus on. So it's been a struggle for patients.
Absolutely. Loveleen, I see you've changed your location. Let's give it a shot.
Yeah, sorry about that. There's construction going on in my house. So I didn't want so basically, the Letters to My Generation, what we're about is, as I said before, it's a creative outlet for teens and also anyone in general to voice how mental illness has affected them and how
Okay, such sad news. I'm not sure how to help Loveleen, but we're gonna pause you and we're gonna go on to the next question and we'll try again. But Loveleen, try in short bursts because we can get short answers out of you before it freezes for some reason. So we'll try that, okay? Shake your head if you're okay. We're good. Okay. So let's go on to the next question, and Loveleen, you can address this one as well. So Senator, Commissioner, Dr. Orlowski, Loveleen, we had to pivot when March came around. And Dr. Orlowski, you spoke about telehealth a little bit. Senator Keller, you were on the backside of fighting like crazy to make sure the telehealth standards were being met. And what did that look like? And what does it mean for people today in terms of access? Like, where can they go for telehealth?
Senate Bill 212 passed this legislative session. We did not originate it, but we were actively engaged in the passage. And with the Division of Insurance in writing rules for the private sector and in healthcare policy and financing for writing rules on delivery of services on the Medicaid side. The bill that passed is making permanent a lot of the emergency rules that the federal government came out with in terms of telehealth. Specifically that not just computer-based, but as Dr. Orlowski mentioned, audio-based, meaning your phone. This is a big deal because many people don't have computers, or they live in parts of the state where the broadband is not installed, and so they don't have access to wireless, but they have phones. Everybody has phones. So the bill allows for providers to be able to bill for their services by phone and or by computer. They can get reimbursed at the same rate as an in-person visit, which had been a problem. And they cannot require any additional co-pays or deductibles based on telehealth services that are different than what they already do for the in-person visit side. So those were pretty big advances in terms of the telehealth piece. We know that this will be a huge boon to being able to access a lot more people more efficiently. For example, the mental health centers have mentioned that the no-show rate especially for follow-up appointments and any given day in terms of in-person care was about 25 to 30%. With telehealth, it's down less than 5%. We also know that people in their homes are more likely, especially men, are more likely to take advantage of seeking some assistance with anxiety and or depression, whether it's due to COVID or not, if they're in their home and nobody knows, that they can maintain that privacy. So nobody knows that they drove somewhere and that they're, they might be seen in the clinic or whatever, that they can have that privacy. We will always have people who will need to visit in person, and that is certainly the case, and it always will be there. But the expansion of telehealth is really significant in terms of reaching more people. And I should mention that for senior citizens who are on Medicare, we were successful as Mental Health America as a national organization, along with NAMI, the National Council on Behavioral Health, and some other nonprofits, to lobby and get from the federal Centers for Medicaid and Medicare Services audio, meaning phone use, for mental health conditions in Medicare, and that's new. We had not had that before. So seniors will, who face a great shortage of psychiatric and behavioral health providers, are now going to be able to have increased access to where they can stay home and don't have to worry about leaving the house.
That's such a huge deal because especially with their increased risk of severe complications. So Commissioner Tedesco, one of the things that has been impacted greatly, as Senator Keller talked about, was our budget. We were able to get some new monies into the county specifically for behavioral health supports. Can you talk a little bit about what's available at the county level, and what can I do if I have a friend who needs help in Adams County?
I think that's a great question, and thank you, Representative. I sent a lot of documents over to your staff Maybe, I don't know if I can share my screen, but maybe if they could share. There's one that talks about COVID aid, and it talks about our distributions of that COVID aid. I do want to shortly, point out that in there, it does state that in Adams County, the mental health care providers under contract with the county have not asked for direct aid from those dollars, which is really interesting, based on the move to telehealth and some of the different avenues of that aid that could help them. We had none that came forward and asked for that aid. And in an environment that we're working in right now, where we're trying to expand the resources, I would think that they would try to utilize some of that money. But it was really interesting to me on that. But if you're able to see the screen, let me see if I can pull it up. I will.
I don't think you can share the screen, but what we'll do is we'll drop a link in on YouTube after this goes up.
And I will tell you that if you're looking for resources in anything that we've utilized the COVID monies for, you can go to the site that I gave to the group, and they can put it in the chat. And it's the covid19.org at Adams County. So they have it. They'll put it in the chat. I don't know it exactly off the top of my head. I don't want to give you the wrong site, but it's a great resource. And they also have the Tri-County one, which also has other resources that you could access.
Excellent. Thank you so much, Commissioner. Dr. Orlowski, you talked a little bit about this huge transition also to telehealth services. What is different, do you think, for individuals in engaging in this telehealth fashion? Can you get as valuable a therapeutic experience? What about group therapies and things like that? What are you familiar with that is out there that people should be looking for, so as not to need to take a break from therapy during this extremely stressful time?
Right. I believe that all methods of therapy are still kind of taking place. What I mean by that is individual therapy, couples therapy, groups therapy. I believe that there is sort of a place for all of that online and virtually. I think what's been really great is this is the first time in my life I've ever had to do therapy in person wearing a face mask. Since there's so much nonverbal communication that's normally taking place during a therapy session, that's been a little bit challenging. In addition to, people are kind of all across the spectrum in terms of how comfortable they are actually coming in. I work in integrated primary care. So coming into a clinic, for example, causes some people a little bit more anxiety. So this allows the opportunity for people to stay at home and feel safe. And when you're feeling safe and you're feeling more comforted, you're feeling more capable of talking about things that are a little more vulnerable. So I think that there's definitely a place for that. And in some ways it can be very, very helpful, especially during these times when it feels a little bit less comfortable sometimes for some people to be entering into a clinic.
Yeah, I would tend to agree. So I took my therapy online, and what's interesting about my experience is my healthcare system has an integrated app. So I'm, like holding the phone every which way. Of course, worried about the angle because you don't usually see your face when you're having therapy. So that's been an interesting challenge, but I'm so grateful that the resources are still there and that people don't have to stop having therapy, because as a non-professional, I can say that I believe stopping therapy at a time of such great stress, this is the wrong time Absolutely. To stop having help with your health. Okay, Loveline, I had a thought. If you turn off your camera, it takes less bandwidth, and we might actually be able to hear you. So give it a shot. How are you doing? How are your friends? Go.
Okay, I'm not sure if this is still working, but
yes,
I'm doing really well, actually. I mean, obviously during these times of quarantine, it's been a little like lonely, and I'm like not able to see them as much. And as Dr. Orlowski said too, it's just so hard to like, without having that physical connection is a lot harder, and it's like completely different. So I'm still adjusting and everything, but overall I've been pretty good.
That's amazing to hear. Talk about how Letters to My Generation has been continuing during this time.
So basically Letters to My Generation has been continuing by, we're doing, instead of like meetings, we're doing virtual meetings now. And we used to be able to go and protest, but now we have to do that with like caution. Another thing that we're doing, it's been a little bit harder because we're not able to collaborate as much together in person, because that's usually when like we have like a lot of ideas and we have a lot of different ways to for the organization. It's been harder to kind of meet with other constituents too, but overall than that, it hasn't been too difficult yet. So
Okay, I'm really glad to hear it. And I'm glad that we could hear you. So that was a great little trick we just did there. And as we come around for the next cycle of questions, you'll keep your camera off and we'll be able to actually continue talking with you and hearing your important contribution here. So going back to the top, Senator Keller, as we look forward, what impact are you preparing for of COVID on individuals who maybe never sought out mental health care before?
We are on our website, Mental Health Colorado. If you go to our website, we have a anonymous screening that we have downloaded from our national organization, Mental Health America, that an individual could take at home, just informally, which covers 10 different conditions, anxiety being one, depression being another, etc. We have seen a huge spike in the number of people accessing that website. And we have seen depression and anxiety are the two two conditions in which people are asking for help the most. We know that everyone in the mental health community is quite aware of and is anticipating a huge need in part of the general public for reassurance, for establishing connection for anxiety and depression. And so we're trying to build that in terms of not just policy, but in terms of resources that we can offer people. All of the information that we can get out to our volunteer base, too. We have a volunteer base called the Brainwave. We're setting up webinars, things like this. We're not direct provider of services, so for us it would be an educational effort for the most part. But I can tell you that in discussions that I'm having with an awful lot of mental health professionals, something that they concentrate on and are really concerned with is that, as someone said last night to me, we're having, if you will, an assault on the American psyche. And the assault on the American psyche is that we have a condition for which we are not handling it all that well. We don't have a strong national, strong federal leadership where we have uniformity. We don't have public will that is uniform in how to address this. We don't have the professionals, and when that I meant political, the political will on a part of many of our elected officials are not all there. And so we have all of these things are going on, and it's a major disruption in our daily living and the belief that we can handle anything. And we have in the history of our nation, we always have. We're going to come through this too. We're going to handle this as well, but we stumbled. We got off to a difficult start. And that has shaken people's confidence. And so the world we knew where we were just, let's just run out and get a pizza. Let's just run out and meet somebody over, our friends over at the local restaurant. Let's just go to a movie. That's gone. And it's a major disruption in our daily life, and it's disturbing. So when I talk to people who have anxiety or depression disorders, and they're due to stigma or whatever they're embarrassed to talk about it, and they've told me this, I say, hey, use COVID as an excuse. Talk about how COVID is because number one, it is. And number two, everybody has it. So everyone will relate. Everyone will say, oh yeah, I've been upset about COVID too, and da da da, and it makes me anxious and da da da. And that's how to be able to be a little bit more open about it and talk to your friends and families about it, and hopefully be able to help each other deal with this situation.
Excellent suggestions right there. Commissioner Tedesco, if I may, I know that you have done some specific work to help foster families during this time. And I also know that they have had a unique impact by COVID. Do you want to talk a little bit about your work with Foster Source and how we are keeping foster families together and safe and getting the resources they need during this time?
Absolutely. We used a lot of the CARES Act funding, and we partnered with agencies like Foster Source, who have direct resources available for our foster families across Adams County and really across the state. And what happened is that we knew that it was a double impact for our foster families. One, even though they may have had to isolate, usually a lot of these kids have health concerns that doesn't allow the family to go out there and do the normal things that other families can do. And they don't have the resources that are normally available because of restrictions through the foster care system. And so we've tried to work around that. We have dedicated funding to meals. We're distributing on a monthly basis a meal package through Foster Source so that our foster families can feed their families, at least have a hot, nutritious meal for the 4 weeks that they have in between, to kind of fill the gap for the times they can't get to the grocery store or they can't get the supplies they need. But we're also, trying to put together a lot of resources that are available to them either through testing or telehealth. We're trying to connect them with the telehealth community and trying to get them plugged in so that their ongoing needs, they don't have to put their entire family at risk by going into an appointment. But as I don't want to know, I want to know if I should call you Dr. Orlowski. I want to make sure I get it right. But, as she spoke, it's hard because some of these kids give tells in what's going on in their life and in their health aspects. And through telehealth, it's very hard to pick up on those cues. And again, I'm not a professional, but I hear the families talking about this and their concern, and are they getting an appropriate diagnosis in the environment that we're in right now? And that's really concerning. And so, through the CARES Act funding, through county dollars, we're really trying to, overcome those obstacles.
And those are some significant obstacles, and I appreciate all the work that you and the county have done in this particular area. And Dr. Orlowski, as you heard the commissioner talking, and as you alluded to when you discussed having to practice medicine with a face mask on, are there ways to engage our youth to be able to put them at ease and to be able to get them the exact level of help they need? I don't know if I've asked that question eloquently.
I think this is an adjustment not only for people seeking treatment, but also for all clinicians who hadn't previously done virtual or home telehealth, right? So there's a little bit of adjustment, but I think that just continuing to work on establishing that rapport, and especially for children and particularly younger children, I'm finding just the parent involvement is so much more critical than ever before. I have some small kids right now that, especially like a 5-year-old, for example, would never be able to sustain the typical 45-minute session virtually, right? So we work with just what the attention span is looking like, and then parents need to be involved, and it's that much more critical and important that parents are involved, right? But when you're working with older kids who do have more of an attention span and can sustain that, in some ways, for that generation, they're used to doing a lot of things on their phones, and so I think that maybe the adjustments specific to that isn't as big. But certainly I think it's just that much more important just to really try to establish that good rapport.
Yeah, rapport, always key. Loveline, I'm curious about how you are doing with the proposal of school opening, and what kind of an impact is that having on you and on your peers?
So with school reopening, well, I have some like personal concerns with that too. But when I was just talking to this with my peers, I was like, it's kind of like a reckless decision because one, if we're in a, I understand that there's going to be, like specific like protocols and how there's going to be like you're going to be 6 feet apart from, but also at the same time, it's like I understand that online school wasn't probably for a lot of people it wasn't the best thing that they had, but it was keeping us safe, and that's the thing that was like my biggest priority to me was. So when I was talking about this with my peers, I was like, well, if we see a skyrocketing if like the coronavirus cases keeps going up, and well, we can kind of tell why, because schools are now reopening. I'm in the Jefferson County Public District, so they said that they're going to be doing school online school for 2 weeks, and to see how that goes. But I don't think that's I'm more concerned with the safety of the students and staff over there too, because it's not like we have more of a risk. It's way more risky to have us going back to like us being there physically. The one thing that correlates that I understand why a lot of people want to go back physically is to see like their friends, and a lot of people prefer the physical working environment because it's a lot of people learn better in that way. So I completely understand that. And also like I do miss like classrooms and stuff like that because I'm just more familiar to it, and it's a lot more harder for me to go like learn from a computer screen because I just get like way too like just not distracted, but I just can't focus like for too long, and it's a difficulty for a lot of students. But I personally think that it's much like I think that going through online school would be much safer choice, and although it does create a sense of isolation and loneliness, which is hard because isolating yourself, especially if you like for me personally, when I'm isolated, it's a lot harder for me, and I get a lot more anxious, and I have that more time to like overthink, and so that's definitely one of the things that me and my peers were talking about when it comes to schools reopening.
Thanks for that, Loveline. And I can only imagine the level of stress you are all going through. I'm going to mix the order up a second and ask Dr. Orlowski a question based on what Loveline shared with us. So if we have to go back into isolation for any period of time, and many of us, myself included, are still primarily not leaving the house. I know Commissioner Tedesco and I have talked about how that's really impacted the work that we do right now. But if you're a teenager going into isolation or a college student going back into isolation, what are some tools? What are some tips? How do we stay healthy and safe?
I think using social media, which I think a lot of kids are already very much used to, using your social platforms, getting on and having virtual hours where you're meeting with friends, and it's not exactly the same, but it's about as good as you can get in these circumstances. I was saying with the virtual schedules, I would love to be able to work with the districts and create a schedule where they have the classes virtually over Zoom meetings or whatever platform they're using, but then scheduling in 15 minutes in the morning, 15 minutes in the afternoon, that's specifically to allow the kids in the classrooms to engage with each other and to interact. Just kind of being creative with the resources that we have available so that you're still connecting, or kids who are new to schools having school guidance counselors or teachers try to connect them and introduce them to other kids in the classroom with shared interests so that they feel more part of the community and not so isolated.
Yeah, those are some great ideas. I think it's a fascinating time because we have been working, we being parents, have been working for a long time to figure out how do we keep our kids safe on social media? How do we limit their social media? And now we're like, honey, just get online, talk to your friends, talk to somebody. I don't care where they came. I mean, I do care where they came from. I don't, you know, but we have this change in the way that we are parenting now, because we recognize that we can't be the only faces our children see. And to the extent where it's appropriate, what age do you start having Zoom meetings? I mean, I have friends who have kindergartners who have Zoom kindergarten.
Yeah.
At what point are you able to have those relationships?
You know, I think kids are getting used to technology earlier and earlier. So school age kids, as long as of course they're being monitored and they have their guardians are monitoring what they're doing online. But for most parents, I would say that screen time has sort of gone out the window, right? So before, where they'd really try to restrict it and minimize it, many parents are kind of like, I need you to kind of access your peers this way, or I need you to do your online schooling this way, or I need to get some work done and I need to occupy you for a little bit. Right. So the screen time in terms of the standards and the recommendations that we've made previously have kind of gone out the window, and they're being reevaluated. And I think just as long as the children are mature enough to make safe choices and or are being also monitored appropriately by their guardians is really important.
Yeah, excellent stuff. So we have about 20 minutes left, and I just wanted to say that anybody who is watching can feel free to drop questions in the Q&A. If you're watching on Facebook, feel free to drop a question into Facebook as well. So one of the things that has been paramount on my mind is, how are we going to prepare resources? So Chaz, this is for you, Commissioner Tedesco. How are we going to prepare resources again if there's another work cutting? I believe we saw an increase of SNAP usage during this time. We definitely saw an increase of unemployment insurance during this time, and those are stressful things on the family. What has the county done to be able to reach out to make sure people have SNAP benefits when needed, or other county benefits, and how do they do that in a socially distanced fashion?
I think that's a great question. And the county is really trying to utilize the COVID dollars along with county dollars and beefing up some of our resources and some of our services that we give. You mentioned SNAP. Yes, absolutely. I mean, that we saw a tremendous increase in the last 3 and 4 months. And, unemployment benefits, I mean, that's another one. The county itself had asked for an extension for open enrollment for health insurance. And during that extension, we saw the highest numbers of people applying. And it was because of that extension that we had over 1,000 plus new people in Adams County be able to acquire health insurance, which is critical, just after all the conversations that we've had. The problem is that without more funding coming forward, a lot of those resources won't be available after December. All of this money has to be spent before December. And if you go to the Adams County COVID website, what you can do is you can find all of those resources, whether it be health insurance, human services related, small business related, payroll protection plans, whatever it may be. We have that on our website, and we've had task force that each commissioner has championed. We have right now, I'm championing a testing center, and it's 2 times a week, and it's open to the public. We're only using the rapid tests right now, but we're really focusing on those people that don't have insurance or underinsured, and we're trying to fill that gap for our homeless, our immigrant populations, those types of people. And it's been a tremendous success. Right now, you can access one of those at between 9 and 2 on Thursdays at the Mack Center in Westminster, and then between 2 and 7 at the old Human Services Center off of Colorado and 70th, next to the sheriff's substation, and you can access those services. I mean, you know, we just need funding. We need to be able to find out where are we going to do after December. If the federal government isn't going to issue any more relief dollars, I'm really, you know, concerned as to going into the winter months and with flu and with COVID and the reoccurrences and then school reopening and businesses reopening. I don't know what that's going to look like, but we have to be prepared. We're having those conversations now, and it's really unclear how that funding is going to come forward. I mean, during the first part of the year, and I hate to ramble on, but during the first part of the year, you know, because we didn't have work happening and we didn't have businesses open, a lot of the government agencies are losing funding, and so they're going to have to be very resourceful. We saw what you went through in the Capitol with the budget this year. All these cities and counties are going to have to go through that as well.
True, true, true. And I know you and I met with our Congressman Ed Perlmutter yesterday, Commissioner, and I know that he is working very hard so that we do have some extra resources coming in. So continue to write your members of Congress and let them know that we need help. Senator Keller, so a lot of the work that you have done and that I have done and others have done in the legislature has been about increasing access to mental health care and behavioral health care in total. How good of a job are we doing in Colorado on reaching people, and what do we have to do to reach more, or are we just fine where we are?
We are definitely not fine where we are. I think you knew that. So we have as our slogan, mental wellness through aging, through all the lifespan, mental wellness through the lifespan. And so we look at early childhood, and we know that we don't have enough early childhood mental health consultants, for example, or early childhood providers who can talk with families in early childhood, and then going through the school age population. Schools have a great role to play, and it's going to get much, much more important in terms of children going back to school who will have their own anxiety and or depression issues, and how we have more, and we do need to have much more counseling in the schools at each school site, at each location. We know we have to work a lot more on juveniles who are in the juvenile detention system. How do we prevent them from getting there? It's a very large number, and I'm thinking it's something like 85%, but I would say 100% personally of youngsters in the juvenile detention system have mental health issues. I mean, taken from your home, getting caught by the police, going to court, all of that's stressful, and then you're in a confined area for something that you have done. So that's a population we need to do a great deal more on. We need to do a lot more in terms of decriminalizing individuals who are in jail because they may have committed an ordinance offense or a misdemeanor offense, who really don't necessarily need to be there or should be there. They should be receiving mental health treatment instead. How do we decouple for that population places for individuals to go when they are picked up having committed an offense and be able to get treatment rather than to be in jail? That's another whole big population. And then our senior population. We do have programs for seniors, but they're not robust. And we need to have a lot more home visitation. We need to have a lot more of the telehealth for them. We need to have a lot more programs for seniors who are experiencing depression to be able, and caregivers. We need to have a lot more supports for caregivers. Caregivers they get burned out, they get tired, they have their own depression and anxiety. And how do we care for them, giving them respite care or giving them mentors or giving them supports So across the whole span, we know that we need to do a lot more. We're hoping to be able to build on what we've got. And we did have a setback because some of the things that we have been doing to address this have been cut. Our funding was cut. But we're going to continue to rebuild and to try to do a lot. I think a lot can be done at the community level. And we talk a lot at the state about state funding, and that's fine. But the actual delivery of services is at the county and the city level, and the school board level, and the public health level, and that's the area where individuals feel the most comfortable is their neighborhood and their community. And so investing more in neighborhoods and communities and how we pull people together at the local level is something else that I think we need to accentuate a lot more and emphasize a lot more than we have in the past.
Absolutely, and why I'm so grateful for the partnership of Commissioner Tedesco, who values behavioral healthcare services. Dr. Orlowski, I was going to ask you, we have, as we spoke about today, a number of people who may be entering the system and needing mental health care for the first time. What kind of guidance, advice, or suggestions might you be able to give for somebody who's reaching out for care for the first time?
Yeah, I would say that it's hard. It's not always easy. It's a big step to finally make that decision to get help for something that you're struggling with, and then to have to talk about it and establishing a relationship with someone who you're just getting to know them, but you're talking about very possibly vulnerable things, and that's not easy, but it's worth it. Research has really demonstrated that there's so much efficacy in seeking early treatment. Preventative care is a thing, especially in the middle of a pandemic, right? So we know that there's a direct relationship, for example, between stress and disease or illness, and that's something that we should be paying attention to right now, especially, and we can help to prevent the escalation of other illness. So it is a big step, but it's worth it. And I would say, just go to the place that you feel most comfortable, whether that's seeking out behavioral health provider at your school if you're a student, or seeking out a community mental health agency, going into your primary care office if it's an integrated primary care office, you can seek behavioral health there. I think it can be really, really helpful to seek out a referral from people who you trust already, and that makes a really big difference. So if you're working with a medical provider who works directly with a behavioral health provider, that makes a difference because you already have that trusted relationship. Or if it's at school and you've already had contact with a behavioral health provider at school, for example, that can make it feel a little bit easier.
I want you to break it down for me a little bit more. What words do I say? What do I ask? I mean, how do I ask my friend?
The appointment and say, I've been struggling. I've been feeling this way or that way. And a lot of people don't necessarily know the word, or if it is a specific diagnosis, they don't really understand that. They understand how they feel. So share with the person who's scheduling your appointment, share with them what you're feeling physically, how that's different from your normal functioning, share with them how you're feeling emotionally. If there's been any major life event in addition to COVID that's been going on and taking place in your life that matters, just share the symptoms that feel meaningful to you, that are a difference as compared to your normal functioning.
Thank you for that. Yeah, I think those first words are super hard. And I want to take this moment, if you're in Colorado and you just need to talk to somebody right now, you can text the word talk to 38255 and you can get support right now here in Colorado. Loveleen, let me ask you, I've been spending a fair amount of time, probably not as much as I could, watching YouTube with my amazing daughter. And what I have noticed about YouTubers is that they, or at least the ones that we've been watching, they've been exceptionally open about their mental health concerns. Do you think that is helpful in reducing stigma around mental health? And do you think that it's just for your generation, or what?
Oh yeah, 100%. one thing that has really helped me is some of the people that I look up to the most, and when they're so vulnerable with like their audience and like their fans about, you know, like the human struggles, I just feel like a lot more human. And especially like celebrities that you look up to or different artists, you know, like especially through me, I love listening to music when artists like like choose to put their struggles with mental health and through their music, and I think that's so comforting, and I think that it's so amazing to be that vulnerable towards so many people. So I could say it definitely helps because it just makes you feel more human, and I think that it's such a great like thing of a role model to do, especially for younger kids. Is to just be so open about it, like, hey, like everyone struggles with this, and like there's no reason to like always be like it's okay and put a mask on, and you know, because I think that a lot of celebrities tend to do that because everyone wants to strive for their life and, you know, their fame or their fortune or whatever it is, and for them to just be open about their struggles as well, and you know how they deal with that. The For with me, I also think that when it really kind of pushes you more to want to get help and be like, you know, maybe there is something that I want to get checked out, and that a lot of the things when a lot of songs that resonated with me was kind of the reason why I wanted to go into therapy, and to be, and because a lot of the emotions that they were talking about, like I feel that way too. Should I like maybe it'll be helpful to go see a therapist or behavioral health therapist.
That's awesome to hear. Okay, we're going to do a lightning round, and we're going to start with Loveline because you got cut off first. Loveline, who is Letters to My Generation for, and how can people get involved?
Letters to My Generation is for anyone. That does, you don't have to be a Gen Z, or you don't have to, you know, be a certain age group. And how you join is basically you can submit a letter through through me, or you can we have the Josh just put the link down below. You can also check our website out and submit a letter, and you don't have to have like certain qualifications to like, you know, be a certain this. We want to have as many people speak out on their mental illnesses, or just even if you don't have one, just, you know, like speaking out of your like struggles and like behavioral struggles that you have as well too. Like for me, this is getting like kind of like if on like more personal level, when I joined Letters to My Generation, I was just diagnosed with major depressive disorder and generalized anxiety disorder. I was just diagnosed with that, and I was so eagerly passionate about that because a lot of people have invalidated me because of that. And Letters to My Generation was, and we wanted to create a way that doesn't invalidate that, and you know, to be more expressive about it, and like be like it's okay to talk about it. There's not like it's okay to, you know, feel like the certain ways.
Thank you, Loveline. Thank you so much. Dr. Orlowski, one action you would like somebody listening today to take?
If you are really having a hard time adjusting with COVID or any of the number of other things that we've had to deal with since the beginning of the year, the changes in our lives that have affected just all of us in such a significant way, if you're really having a hard time making that adjustment and you're struggling to feel normal, like your normal level of functioning, reach out to somebody, whether it's even a friend or a relative, whether it's someone in the professional realm, whatever you think you need, but seeking out support is really, really important during high times of stress.
Excellent. Senator Keller, one action you would like someone listening to take?
I would love for you to visit our website at Mental Health Colorado and consider joining our advocacy work group, the Brainwave. We have webinars, we have links to resources, and we call upon you to be our eyes and ears in the community and to be our engaged public. This last year, the year before, in 2019, we had 8 bills. All of them passed, and all of them had people in our Brainwave testify in favor of it or get a hold of their legislator and ask for a vote, whether they called or whether they wrote. We have telling and sharing your story. You can do that, and we will help you with that and edit it with you in that. You can work with us on press releases. There's lots of ways to get involved, but do get involved because it does make a difference. Your voice does matter.
Thank you. Commissioner, with the last word, one thing you would like our viewing audience to do?
I'll just tell you, reach out to somebody, make connections, go through your family tree and just call people and have a conversation. Right now, is the perfect time to do that, because whether people tell you or they don't tell you that they're suffering, everybody's suffering during this. And in one fashion or another, everybody's suffering. And, I'm so privileged to work with people like Daphne. By the way, we have suicide awareness. We do a lot together in the Capitol, in the community. Just between ourselves, we call each other for encouragement. It's so refreshing to be here. This has been such an amazing event with such good information. And again, I'm humbled by the people that are on this panel with me. I just look up to you and thank you for all you've done.
Commissioner Tedesco and I have a mutual admiration society, and it's always wonderful to work with people who share your values and are fighting for the same things. Thank you so much for spending time with us today. And I do wish to echo the sentiments of Commissioner Tedesco. It's never too late to reach out to someone in your family. I'll echo Dr. Orlowski. It is never too late to reach out for help. And even more, it's never too early. We think about our crisis hotline. You get to define what crisis is and what crisis looks like to you. So you don't have to be on the edge. Reach out for help before you get there. When I work with communities like Lovelines, I like to tell them suicide doesn't ever have to be the end of your story. We can make a different ending, and you're gonna like that ending so much more. So my love to everyone. Please join us next week at 3 o'clock, where we'll discuss another topic. You can follow us on YouTube to get information or see the videos after we have done them live. You can watch us live on Zoom or on Facebook. And please feel free to send us questions continually, because we'll continue to look at those comments and try to get you the help that you need. Thank you all. Have a great day.
Bye. Stay well.